Hey everyone, welcome to my channel The Doctor. Today the topic we are going to talk about is features of the pulp that distinguish pulp from other tissues. So what is dental pulp? Pulp is soft mesenchymal connective tissue that occupies pulp cavity in the central part of the teeth. So that was the definition of dental pulp, and going towards our main topic, that is features of the dental pulp that distinguish pulp from other tissues. Is first on our list is pulp is surrounded by rigid walls. There you can see in the diagrams the rigid walls all around the pulp that are made up of dentine, enamel and cementum. These three structures, that is enamel, dentine and cementum, form the hard walls all around the pulp except the apical foramen, that is a very small area, so we are not going to give it a count. So we can say that pulp is surrounded by rigid wall almost all over, so it is unable to expand in response to injury as a part of inflammatory process. When the pulp is surrounded by rigid wall, it is unable to expand as a result of inflammatory process. So when it is unable to expand as a result of inflammatory process, but the pressure will be there because of inflammatory process, but the pulp cannot expand, it will exert pressure on nerves, and these nerves will get stimulated earlier and will have a higher pain threshold that will increase the patient response to pain and decrease the tolerance of tooth pain, and that's why the most of the people say that tooth pain is worst. So therefore pulpal tissue is susceptible to change in pressure affecting the pain threshold, and when the pain threshold is high, the simple painkillers or the low dose painkillers are not effective, and that's why most of the people take the high dose painkillers for the relief of pain. So this is the one of the feature that distinguish pulp from other tissue, that its inability to expand after inflammatory process, and this is because of the rigid wall surrounding the pulp, and because of this its inability, it all of the pressure as a result of inflammatory process is over the nerves, that make it worse for the patient to suffer because the pain is very high because of the pressure. So second feature that distinguish pulp from other tissues in the body is that there is minimal collateral blood supply to pulpal tissue. As we all know, the blood supply to the pulpal tissue is only through the apical foramen, which are very little arterioles and venules, and there is no true collateral blood circulation or minimal collateral blood circulation. And this collateral blood circulation reduces the capacity for repair following injury, because when there is injury and the body needs some things to repair, like the cells, defense cells, fibroblasts or other cells to repair that injury, and when the blood supply is very less and there is minimal collateral blood circulation, then there is very little capacity for repair of following injury, and that's the reason when the pulp tissue is infected over the limit, it cannot be corrected by itself, and that will eventually need the root canal treatment. Number third feature of the pulp that distinguish pulp from other tissue is that the pulp is composed almost entirely of simple connective tissue. At its periphery there is layer of highly specialized cells, the odontoblasts. Although the inside of the pulp is very simple connective tissue, but the periphery there is layer of highly specialized cells, and these cells make it different from all the tissues in the bodies, because secondary dentine is gradually deposited by the odontoblasts, that are specialized cells of the pulp, as a physiological process which reduces the blood supply and therefore the resistance to infection or trauma. So when the trauma is in children teeth, it is easy for pulp to correct by itself, because there is the blood supply is large and there is more chances of repair after trauma or infection. But in the elderly people, because there is a very thick layer of secondary dentin as a result of physiological process by odontoblast, that reduces the blood supply and therefore the resistance to infection or trauma is decreased. Number 4 feature of the pulp that distinguish it from the other tissues in the body is that the innervation of pulp tissue is both simple and complex. Simple is that there are only free nerve endings and consequently the pulp lacks proprioception. So the pulp tissue has no proprioceptive properties, while the other tissues in the body mostly have the proprioceptive property. It is because the innervation of pulp is simple and complex at the same time. Simple because there is no proprioception, and complex because of innervation of odontoblast, which produces a high level of sensitivity to thermal and chemical change. As you can see there, the innervation is to the odontoblast. There are much innervation to the odontoblast, which produces a high level of sensitivity as odontoblast extend in the dentinal tubules. So when the innervation is to odontoblast, that increases the sensitivity to thermal and chemical change, especially when enamel is becomes changed due to any cause like caries or trauma. Because of when the enamel is thin, there is a high level of sensitivity to thermal and chemical changes. Don't forget to like, share, subscribe and comment on our video for the support. Thanks for watching. Keep watching for further interested and educational topics. Thank you.